Hey guys, Steve Collins from Joint Physio here. So we're just going to talk through some of the basic biomechanics of the squat and cues that could be useful, and then we'll be putting them into place, into practice. So our squat, we have three different types depending on bar position of a standard squat. You're going to have low bar back squat, usually more weight for most people lifted that, it's more hip dominant. You're going to have a high bar back squat, kind of in between the two, a little bit more knee dominant, and then you're going to have a front squat, the most knee dominant with your shear forces. The EMG kind of activity shows that they all are both very similar across the board for hip and knee dominance once the weight is heavy enough up towards 1 RM. So, low bar back squat. So this is going to sit on the spine of your scapula. Usually your thumb's going to wrap over the bar rather than around the bar. So this here, what we're going to be looking for from the back is that position. You're going to be able to see our knees, what our knees are doing, okay? And you're going to be able to get a rough idea of kind of how much kind of hip lean or trunk lean they have. But your main cue here is for your knees and your feet from this position. So what you're trying to cue someone on here is some sort of cue to keep their knees out, okay? So I like to use magnets, but basically here, my big cue is that all I want you to think about is driving your knees out, okay? So that's the position, that's what it should look like from there. So you should also see the level of trunk lean should be equal as it's going down and up, so you shouldn't see hips going up before trunk, okay? Or you shouldn't see trunk going excessively up before your hips. So, but from the back, you're mostly looking knee and foot position. So, from the side angle now, this is where you really get to see kind of your hips. So, this type of squat is a really hip dominant squat. So this should be driving backwards quite a decent way, and you should be starting bit by suggesting they break at the hips first. So what you're going to do is push your bottom backwards first, okay? So bottom backwards. The other thing here is head position. So they should be looking about 3 or 4 meters in front of them at the ground. So that keeps nice neutral neck position, trying to avoid looking up, okay, or overly looking down. So another good cue here is almost like you're trying to hold a ball in between your chest and your neck. Cool.